Hello, AP students. This is Mrs. Politsky, and I have notes for Chapter 13, Therapies for Psychological Disorders. And as we go along, make sure you're filling in the information that you need. So to begin with, therapy is a general term for any treatment process in psychology or psychiatry. Therapy typically refers to a variety of psychological and biomedical techniques aimed at dealing with mental disorders or coping with living problems. What is therapy? The reality of modern therapy differs from the old stereotypes. First, most therapists don't have patients lie on a couch. Second, people now seek therapeutic help for a wide range of problems aside from those that are in the DSM-V or DSM-V-5. Third, it's a way in which the stereotype of therapy is false. Some forms of therapy now involve as much as action as they do talk and interpretation. Therapy for psychological disorders takes a variety of forms, but all involve some relationship focused on improving a person's mental behavior and social functioning. Entering therapy. Most often people enter therapy when they have a problem that they're unable to resolve by themselves. You don't have to be crazy to seek therapy. The therapeutic relationship and the goals of therapy. Professional therapists have expertise in identifying mental disorders and in using therapeutic techniques that a friend probably would not know about and certainly would not have the skills to employ. A professional relationship with the therapist differs from a friendship or kinship. So, what are the components of therapy? Nearly all forms of therapy, in all of these forms, there is some sort of relationship between the therapist and the patient, the client seeking assistance. There must be trust. This is an essential element here. You and your therapist must be able to work together as allies on the same side towards the same goals. And in joining forces, you cope to deal with and solve the problems that have been bringing you into therapy. The therapeutic process typically involves some or all of the following. First is identifying the problem, agreeing on a simple description of circumstances or feelings to be changed, or in the case of the DSM-5, the disorders. This step may call for a formal diagnosis about what is wrong. Identifying the cause of the problem or the condition that maintains the problem. This involves searching for the source of the patient or the client's discomfort. Deciding on and carrying out some form of treatment. This involves selecting a specific type of therapy designed to minimize or eliminate the troublesome symptoms. Who does therapy? People turn to trained health professionals only when their psychological problems become severe or persist for an extended period of time. Those seeking therapy usually choose one of the 7 main types of professional helpers that can include counselors, counseling psychologists, clinical psychologists, psychiatrists, psychoanalyst, psychiatric nurse practitioners, clinical psychiatrists, social workers, and pastoral counselors. Clinical psychologists are seeking to obtain prescription privileges. So the history and cultural context. We've talked a little bit about the history of psychology, and in a way it kind of follows the same line of the history of therapy. Again, people in the medieval times often interpreted mental disorders as the work of the devil or demons. The job of the therapist was to perform an exorcism or to beat the devil out of the disordered individual. Reformers such as Dorothea Dix have urged that the mentally ill be placed in institutions or asylums where they could be shielded from the stress of the world and from brutal therapies that had been all too customary. Inside the asylum, the patients would at times be placed in straitjackets, restraints, cages. Some patients were beaten, or given cold showers, or abused. The modern approach to therapy is very different. Modern health professionals have abandoned the old model in favor of treating patients in a couple different ways. The psychological therapies. These are therapies based on psychological principles rather than the biological methods. So that would be like talk therapy, behavioral therapy, which are all kind of under the guise of psychotherapy. And the other would be the biomedical therapies. These are treatments that focus on altering the brain, especially with drugs, psychosurgery, or electroconvulsive therapy. The physician or nurse practitioner can employ a variety of drugs, including antidepressants, tranquilizers, and stimulants. The disorder in the therapy and the cultural context. The ways of thinking about treating mental disorders vary across the cultures. In individualistic Western societies, such as North America and Europe, the view and practices generally regard psychological disorders as a result of disease processes, abnormal genetics, disordered thinking, unhealthy environments, and stressors. In collective cultures, they often have quite different perspectives. Asian societies think of mental disorders as a disconnect between the person and the group. In African societies, they believe that mental disorders result when the individual becomes estranged from nature and from the community, including the community of ancestral spirits. African use of group support and therapy has developed into a procedure called network therapy. Thank you very much.